Hi everyone, welcome to our July community call. We're just going to give folks a couple extra minutes to hop on the line, and then we'll go ahead and get started. Hi, for folks who just joined, we're just going to give folks another minute, and then we'll go ahead and get started. Hi everyone, and welcome to the July installment of our monthly webinar series. Thanks for being on time. We're going to go ahead and get started. So joining me today, I have Katrina Dizon Mariategui, our Director of National Policy, and for technical assistance, I have Kelsey Hendrickson, our Operations Manager, on the line. So that's what we look like. Next, I'll just go over a few housekeeping rules for those of you who might not have joined our calls before. Everyone's going to be placed on mute right now. If you want to comment or ask a question, you have to be logged into the webinar. Feel free to shoot us comments and questions throughout the webinar. We might save them until the end, but to do that, you just go in your control panel and then go to the question section and type your question and send it to us. As well, on your control panel, there will be a handout section where you can download PDFs that we've attached relevant to this presentation, including a PDF copy of the slideshow for today. And just FYI, we're going to be recording this webinar and sharing it on social media later this week, so no need to take serious notes. So with that, we're going to go ahead and start off our call as we usually do with asking where everyone is joining us from today. So East Coast, West Coast, Midwest, South, or somewhere we didn't mention. So we'll give folks a minute or two to fill that out, and then we'll see who we have on the line. All right, we'll give folks maybe 15 more seconds. All right, so let's see who we have on the line. All right, so almost 3/4 are from the West Coast, so thanks for joining us around your lunchtime. And then about 1/4 of us are from the East Coast, so guess we have to circulate this presentation to our Midwest and South folks. All right, so our next question, we want to see how many of you have attended CRAC community calls before. So have you attended 4 or more, maybe 3, 2, or 1, or is this your first one? We'll give folks another minute. About 10 more seconds. All right, let's see what we got. Great, so we have about a little more than 1/4. This is your first call, so welcome. Thanks for joining us. Hopefully you'll be back for more. We have the same amount of folks who this is their 5th or 6th or 7th call, so thanks for sticking around, and then everyone else kind of just falls in the middle. So with that, we'll go ahead and go to the agenda for today's call. So we'll start off with policy updates both on the national level and our California state policy. And then we'll go into education and mobilization with a focus on census, since that's obviously a huge thing coming up this year and next. And then some opportunities for folks to get engaged and take action, and then we can address questions and comments at the end. So with that, I will punt it to Katrina for national policy.
Great. Thank you so much, Alyssa, and thank you everyone for joining us for this month's community call. We'll get started with some national policy updates, beginning with in our immigration work. So this month, Representative Judy Chu out of California, I know many of you are calling in from California, she introduced the Reuniting Families Act. It's basically a policy that helps to make it easier for families to reunite with their loved ones through our family-based immigration system. As we know, the ability for us to sponsor our loved ones to come here has been a critical policy that has really helped many Southeast Asian Americans be together, especially after the war. And as a result of this, we've seen a lot of people be together, but still hundreds of thousands and even millions continue to wait for years due to these massive backlogs. For instance, we know that immigrants from Vietnam face the 4th largest number of visa backlogs at over 250,000. Cambodia has about 9,000, and then Laos has a backlog of close to 2,000. So family members caught in these lines can usually wait up to 13 years for their application to be processed. The introduction of this bill also includes family unity waivers, which would provide support for those with deportation relief. So this could possibly support about 15,000 Southeast Asians still living in the country with a final order of removal. We urge everybody to call your congressional representative to encourage them to sponsor this important legislation. And for more information on the bill, if you're interested, you can look at the handout section of GoToWebinar. With that, wanted to do a quick poll. We'd love to hear if you or any family member has ever been sponsored or are currently in the process of sponsoring a family member to come to the U.S. The options are yes, waited or still waiting 15 years, 10 years, 5 years, or less than 5 years. And lastly, if the answer is no, please let us know that as well. We'll give folks a few seconds and we'll check out the results. Great, thank you for those that participated. Let's check out the results. So almost half actually haven't had to go through this process. but a good chunk of about 30% have had to wait or are waiting over 10 years. Some have had to wait 5 years or more, and some a little less than 5 years. So thank you for sharing that. It's just helpful for us to know that how the policies we're supporting is how our community members are impacted by them or benefiting from them. The next is just some updates around our health work. So in May, the Office of Civil Rights under the Department of Health and Human Services released a rule that would basically reinterpret civil rights protections under the Healthcare Rights Law, or Section 1557 of the Affordable Care Act, which would basically be harmful for community members who are limited English proficient, for those who are transgender, women, and individuals with disability and chronic conditions, because it just basically waters down some of their protections to access healthcare through the ACA. So a number of Asian American advocates are particularly concerned around what this could mean for those that are limited English proficient, including about 35 to 49% of Southeast Asian Americans who do not speak English very well. As many of us know, language barriers are often known to interfere with one's ability to access quality care. And if this rule is finalized, people will have a hard time finding out what their rights are, and they will be more likely to experience discrimination and barriers to care. CRAC will be contributing comments to this proposed rule, and we encourage everyone to do the same. We also encourage folks to share stories of family members that may have had experiences in terms of discrimination accessing healthcare. If you go to the GoToWebinar, we have a few handouts and resources that give a little bit more detail on this specific policy, as well as a digital toolkit, since there is a week of action next week that is being hosted by our partners at the Asian Pacific Islander American Health Forum, to try to encourage folks to submit comments to oppose this terrible rule. With that, a poll question. We'd love to know if you or any family member has ever faced discrimination in our healthcare system. So that could be you, someone in your family, someone in your community, all yes to all of the above, or no, I don't know, and I need more information. Great, thank you for those that participated. Let's check out the results. Wow, that's very interesting. Over half say yes to all of the above, which is definitely very concerning, and it just reinforces that CRAC should be weighing in on this terrible proposal by the Trump administration, and about 11% say no or I need more information. So again, if folks need more details on this policy, on how you can be engaged, we have a few resources folks can check out, and we also encourage you to check out the website of our partners at the Asian Pacific Islander American Health Forum. Cool. So next, we have some updates that we have been sharing in the past couple of calls around this lawsuit around the Affordable Care Act. As we know, or we might have mentioned in previous calls, there were oral arguments on the case in July. We're hearing that a final decision would likely be made by the circuit by the end of the year, and that it would likely be heard by SCOTUS in June of 2020. We are committed to speaking out on how ACA has improved the lives of many Southeast Asian Americans, and because we know that with its passage, we saw uninsured rates in our community be reduced by half. And because the ACA really required essential benefits to be covered by all health insurance plans, we know that Southeast Asians have benefited from access to critical care to improve their well-being, including things around women's health, like maternity, prenatal care, contraceptive coverage, and women-specific preventative care. So we'll make sure to monitor the situation, but in the meantime, we encourage folks to reach out to your lawmakers to express why ACA matters to you and urge them to really work to protect this important policy. Next is an update on a policy that was introduced this summer called the Expand Navigators Resources for Outreach, Learning, and Longevity, or the ENROLL Act. This is one positive development in the national health space. This bill basically restores funding for the ACA Navigator programs. And for those that aren't familiar, Navigators help limited English proficient families understand what can be a very complex enrollment process and empowers them to choose a health plan that works for them. And it's especially critical for the health and well-being of minority communities, including Southeast Asian Americans and elders. So we've been joining our partners in urging the Senate to pass this bill, which would be an important step to reducing health disparities in the United States and restoring the trend of lower health insurance rates among communities of color that has stalled for the first time since the passage of the ACA. With that, just a quick poll question. We'd love to know if any of you have ever benefited from a Health Navigator program, for those that are familiar. So either it was yourself, someone in your family, someone in your community, yes to all the above, or you're not sure, you need a little bit more information. Great, thank you for those that participated. Let's check out what you guys shared. So a majority is, again, yes to all of the above, which again reinforces the importance of this policy. A couple of you say yes, someone in your family, and about 22% just need a little bit more information. So we'll make sure to continue monitoring this policy. And again, the leads for this really are our partners at the Asian Pacific Islander American Health Forum. So for more information, we do encourage folks to also reach out to them. Next are just some quick updates around our education work. We have been working with our partners around the civil rights principles for higher education, and the principles cover enforcement of civil rights, promoting access, increasing persistence and completion, affordability, collecting and reporting disaggregated data, designing accountability systems to ensure students receive value from higher ed, excluding for-profit schools unless they demonstrate their value to students, protecting student loan borrowers, ensuring safe and inclusive campus climates, and investing in HBCUs and MSIs. MSI stands for Minority Serving Institutes. HBCUs stand for Historically Black Colleges and Universities. Again, these have been developed with our coalition partners, and they really mirror some of the huge priorities that CREC places on higher education. With that, we'd love to hear from you all. Among the different CREC priorities on higher ed, which ones resonate the most with you? Is it access? Is it affordability? Is it completion? Is it data equity? Or would you say all of them are pretty much equal in how they resonate with you? Great. Thank you for participating. Let's see. Great, that makes sense then. About almost 100% say all of these are equally important to you, which again reinforces that we are pushing the priorities that we're seeing in our communities. And almost 10% say that affordability is a big issue that they're concerned with. So thank you for your feedback on that, and we'll keep folks posted if there are any changes to this platform. Next are just some updates. As folks know, and especially those that have been following our calls, there was a number of different updates around the citizenship question and its inclusion in Census 2020. So if you've been following the news, we know that the Supreme Court blocked the addition of the citizenship question. The courts thought that the administration provided insufficient evidence to show that they would need it to enforce the Voting Rights Act. So to the relief of many community members, we'd like to share that the questionnaire has already begun being printed without this question. This is a huge victory for the community. We know that advocates have been fighting against this addition for the past year, and it's a huge win. But we do know that there's still a lot of work to be done. Even though the citizenship question is not going to be added in the questionnaire, we already know that it's caused a lot of fear and will deter many from participating. So with that, we wanted to ask folks, with this recent development on the citizenship question, how do you think this decision to block the question would impact Southeast Asian participation for Census 2020? Do you feel confident that more Southeast Asians will not participate? Do you feel like Southeast Asians actually still need a lot more information to boost participation? Are you not sure how this will really change anything at all for Southeast Asians? Or you don't know, in general, you just need more information to make that assessment. So we'll give folks a few seconds. Just a few more seconds, and then we'll wrap it up. Okay, let's see what folks said. So it sounds like a majority, 90% feel like the community needs a little more information, which is really helpful for us. We'll talk about it a little bit later, but CRAG does want to prioritize creating more education and content for us to be sharing with the community so that they can make sure that they're counted in 2020. And then about an equal number think that this won't change anything. And then equal number that actually feel confident that more people will participate. So obviously only time will tell, but we are dedicated to mobilizing for Census 2020. So next, just a quick update. We have been engaging with offices to push for additional phone and online translation in Southeast Asian American languages. As folks recall, Lori Trehan sent a letter into the Census Bureau with 38 signatures from members of the House to push for Hmong, Lao, and Cambodian translations in addition to the already existing Vietnamese. And in June, Senator Ed Markey of Massachusetts sent a similar letter with support from 18 senators. And we want to give a special shout out to our partners at the Cambodian Mutual Assistance Association that were really pivotal in reaching out to these offices to urge them to coordinate this effort. And then also to give a shout out to our LAT participants who are actually really critical to hitting up offices while they were here in June to encourage them to sign on to this letter. So we know in general that a number of Southeast Asian households are limited English proficient, but not only that, they also, about 14% live in poverty. So a number of these barriers actually make it more difficult for them to be counted in Census 2020. And we feel that with this additional support, it could really help boost numbers. So we thank Representative Trehan and Senator Markey. If they are your representatives or senators, we definitely encourage you to thank them for their leadership. And if your representative or senator signed on to that letter, feel free to reach out to them as well. With that, we'd love to know from folks for Census 2020, for those that are actually interested in participating, how do you plan to fill out your census questionnaire? Would you want to do it online, through paper form, through the phone, or you're not yet sure, or you don't plan to participate at this point in time? And we'll give folks a few seconds before we check out the results. Thank you, everyone, for participating. Oh, cool. Looks like a majority are going to do it online. This is the first time that there's actually going to be an online form. So I'm glad that hopefully it does help boost participation. 30% aren't sure yet, and a small number are going to do it via paper form. And I'm glad that no one has mentioned they don't plan to participate, so we do hope that everyone on the phone does. And that will really inform some of our outreach strategies, so thank you for participating in that poll. So next, our California team is actually out this week. So I will be providing our California updates for folks. If folks have any questions at the end of the call, we feel free to send it along, and we'll make sure to tap our California team when they're back. So for the California team updates, we know that they've been monitoring the budget and their policy priorities. CRAC applauds the Governor Newsom's California State Legislature for passing their 2019-2020 budget in June. And a part of this budget would really work to expand our ability to do census community outreach and education for increased access to education for low-income students and families, and also health and mental health care for our communities. So in terms of more details on the final allotment on the budget for folks in California that are interested, as we all know, since Census is the only national body of disaggregated data, we really rely on this data to help tell our community stories. The final allotment out of California budget is $30 million, with $2 million being used for local educational agency-focused strategies for census outreach, and $28 million for community outreach and education by government and community-based organizations. For education, in partnership with the College for All Coalition, we advocated for renewal of state-funded college readiness block grants. And the final allotment was $6 million to reinvest for UCs to conduct high school outreach to schools with high populations of underrepresented students. For the health front, there were two budget items this year we've been monitoring. First is AB 512, or the Improving Cultural Competency in County Mental Health. We'll discuss it a little later on, but CRAC and other co-sponsors advocated for financial investments to our mental health delivery system to increase cultural competence. The final allotment was $3 million for ongoing technical assistance to counties on reducing disparities, $5 million one-time funding for innovative grants to invest in non-traditional mental health providers to serve diverse needs of Californians. And then the second policy or budget item is community health navigators for Medi-Cal outreach and enrollment. So in June, funding for community health navigators ended, and many Southeast Asian serving community-based organizations struggled to keep up with the high demand of needing to support and navigate the medical system and institutions. The final allotment was $30 million over 2 years for the federal match to fund community-based outreach to enroll Medi-Cal eligible beneficiaries in California health coverage. Moving to our policy work, I mentioned in the budget piece, but CRAC co-sponsored the Assembly Bill 512, cultural competency in our county mental health system. I mentioned it earlier, but it would really increase cultural and linguistic competence of mental health delivery systems in California by greater stakeholder engagement and oversight. And this bill matters to our community because it increases the quality of cultural and linguistic competence in our services to Southeast Asian community members. The bill made it out of the Senate Health Committee and will be heard in the Senate Appropriations in August. Thank you to all of you on the call who participated in our California Mental Health Story Collection campaign. And we'll be sharing some of the stories that you've submitted with the California State Legislature as we develop the final report. The next two bills are around ethnic studies related bills. The first one is the Assembly Bill 331, Ethnic Studies High School Graduation Requirement. This bill would make ethnic studies a course requirement in high school for graduation for public high schools, including charter schools, by 2024. We care about this bill because we have seen that ethnic study classes really increase commitment to schools and build self-determination, as well as allow diverse student bodies to learn from each other. The bill has moved out of the Senate Education Committee and onto the Senate Appropriations Committee. The next piece is around, well, I guess this is still on the Ethnic Studies Model Curriculum. We know that recently the Instructional Quality Commission released a sample curriculum on the California Department of Education website for review and public comments. The department needs to hear from you to ensure that the Ethnic Studies Model Curriculum is comprehensive and includes diverse Asian American and Southeast Asian American experiences. If you're interested in learning more or weighing in on the curriculum, please don't hesitate to contact Tiffany Tran, our California policy intern. I believe her email should be tiffany@crec.org, or Goia Yang, our Director of California Policy and Programs. Her email will be shared at the end of this webinar. The deadline for comments is August 15th. The next bill is AB 1393, Laotian Histories and Cultural Studies. This requires the California Department of Ed's Instructional Instructional Quality Commission to develop and submit to State Board model curriculum of relative history and cultural study of refugee communities from Laos by December 2020. It moved out of the Senate Education Committee and will be heard in Senate Appropriations in August. And then finally, we have our immigration updates in California. AB 1282, or the No Private ICE Act, is authored by Assembly Member Ash Kalra. The bill would prohibit an officer, employee, contractor, and a contractor of the California Department of Corrections from allowing private security guards to arrest, detain, or take into custody an individual for immigration enforcement purposes. And we've seen a lot of our detained community members who are granted release basically get arrested at these prison sites by private contractors. And reports have indicated that these community members, as well as others impacted by immigration policies, have been violated by private security guards during the process. This bill is led by the Asian Law Caucus, and the bill moved out of the Senate Public Safety Committee and into Senate Appropriations. And with that, thank you for folks for listening to our lengthy policy updates, but I'm happy to pass it on to Alyssa to go over some of our census education and mobilization updates.
Great, thank you, Katrina. So as Katrina mentioned, right now we're going to go into some education and mobilization pieces for Census 2020, which is a huge deal because it dictates about $800 billion in federal funding and how that will be spent over the next 10 years. It also impacts political representation in Congress. So CRAC, along with our partners, are committed to working with everyone in our community to get out resources and information as we approach 2020. So the first thing we wanted to share was the Census Champions Initiative. So this has been launched by the Leadership Conference Education Fund. And what it is it's a network of state, local, and tribal elected or appointed officials who are committed to ensuring a fair and accurate count everywhere, especially in hard-to-count communities. So if you know an elected official who is working hard to make sure that there's a fair and accurate count, you can pass along this information. And when they sign up to be a census champion, they'll receive resources, information, invitations to actions, and that will give them the tools to be able to be a census champion for their community. So that link is there. We also wanted to share that the Census Bureau has released the official Complete Count Committee's map. So as you can see, this will help create awareness in your community and communities across the country as to how you can engage with other organizations and stakeholders who are working to ensure a complete count. There are opportunities to update the information on the map, so you can provide feedback to census.cccmap.list@census.gov, and you can follow the link there, Census CCC Map, to look at the full and complete directory. So we wanted to ask a poll question in terms of the interest level in joining a Census Complete Count Committee in your area. So yes, count me in, maybe need more info, no, but you know others you might be able to recruit, or no, maybe you don't have capacity to participate. So we'll give folks maybe 30 seconds or so, and then see what we get. Great, let's see what we got. Awesome, so over 2/3 of the folks on the call are ready to be counted in and joining a complete count committee, so that's great. Maybe you might need more info, so feel free to reach out. No, but you know others you might be able to send their way, or no, you may not just have capacity. So that's totally fine. That's really helpful to know. And that's a big chunk of what we're focusing on this call for census. We also wanted to inform folks of other opportunities. So as you might have heard, I know a lot of veterans are on the call in terms of our community calls. So We have our upcoming Equity Summit, Moving Mountains. It's going to be held this fall in Sacramento, California on October 2nd through 4th. And what it is, it's going to be a convening of about 200 Southeast Asian American community members, change makers, and we're going to celebrate the community's self-determination. Just wanted to flag that early bird registration ends next Friday, August 2nd. You can visit the website for more information, which is crac.org/movingmountains. And then upcoming in August, keep an eye out for announcements regarding the programming. So things like keynote speaker and the workshops and sessions that we'll be hosting will be set to be announced next month. So hopefully that'll give you a better idea of if it's a good fit for you. And then with that, I will just do a recap of all of the ways that folks on the call can engage. So the first one is supporting the Reuniting Families Act and urging your representative to support on behalf of your community. So that's what Katrina touched base on earlier, and that handout is in your handout section for more info. We also have the comment submission window for opposing the Trump administration's proposal to roll back the ACA civil rights protections. So that National Week of Action is next week, July 29th through August 2nd. So feel free to participate and submit your comments there. As Katrina mentioned earlier, Senator Ed Markey had a letter that advocated for additional Southeast Asian American translations for the census. So if your senators signed on, thank them for their leadership. And then the next three bullets are about the census pieces I just mentioned. So if you want to be a census champion, if you're an elected official or appointed official in your community, feel free to sign up to be a census champion or pass that link along. If you are interested, as about 2/3 of you expressed in joining a complete count committee for census, you can go ahead and get on that map yourself. And then we have our own CRAC Census Pledge form. So with that, we will be providing you with specific updates tailored more so to the Southeast Asian American community. Fact sheets are set to roll out, some things you can share with your own community members that are going to be tailored to the messages that we found were resonating with our community members. And then lastly, following us for more updates. So on social media, we're on Twitter, Facebook, Instagram, joining us for our monthly community calls and making sure you're subscribed to our general listserv. And now I will transition to opening up the floor for questions. Just a few directions on your control panel. If you would like to have your line unmuted, just click on the raise hand icon and we'll tap folks one by one. If you share out verbally, just make sure to share your name. Try to keep it concise and just be respectful on the line. If you want to just type a question, feel free to submit that as well on the question section of the control panel. So we'll give folks see what rolls in maybe in the next minute or so, and then we'll get to answering some.
We have our first question that rolled in. One of our community members is interested in being more engaged with census, but they are asking, does CRAC plan to create or provide any Southeast Asian specific fact sheets that we can help disseminate within our community?
Great question. So with that, our fingers are crossed to hopefully roll out in August the English fact sheets that are going to be segmented by different community groups. So elders, children, young adults, and why census matters specifically to each group. And then hopefully we can get out the Southeast Asian American language translated versions of those in September. So that's our tentative timeline right now. We're working to get those out to y'all as soon as we can. But there are also other resources in the meantime that we can connect you to if it's more urgent need. Any other questions? Great, we have one question. So someone has attempted to contact their state rep's office 2 times and no contact or follow-up back. So should they move on or should they attempt again?
That's a great question. We all know that advocacy can be frustrating sometimes, especially when folks are not being responsive, but we want to remind folks that, you are their constituents, they're accountable to you. So to encourage you to not lose hope or give up, just keep trying. And I would say if you've been calling and leaving messages and they're not responsive, maybe try other mediums like email, even dropping by their offices might be a little bit more effective. And also working maybe with other groups in coalition, that's usually helpful in getting your foot in the door. So thank you for that question.
I just wanted to piggyback off that. So I have some LAT alumni on the line. So as you know, we work on scheduling all those meetings with the offices. And sometimes what I do when I don't get a response by like the 2nd or 3rd time is I go ahead and CC the chief of staff of the policy staff. So basically CCing their boss. And that usually gets a quick response if you want to try that method also.
Hi, I'm Gina. I'm CRAC's Field and Communications intern. I was also dealing with a lot of congressional, lack of response during LAT, and I would also suggest multimedia engagement. So that means emailing, calling, using different methods, and that actually worked in confirming a couple of appointments. So that's also one avenue you can try.
So we have one question from Joseph on the line. So is there any way CRAC could provide support with translating census materials into Southeast Asian languages that are not covered by advancing justice, such as Mian, for example? So with that, we are going to be working with one partner that we have in California that serves the Mian community. So we might try and see if they have capacity to support with Mian translations, but we're definitely open to recommendations if you know of other partners. But our budget permitting, we would prioritize Cambodian, Laotian, and Hmong translations first, and Lao, sorry. But if you have recommendations for other partners we might be able to work with in case our partner in California doesn't have capacity to translate, we can try and reach out to them if we have more room in the budget for additional translations. Great, so we have one question. Are there any demographics you're concerned about, particularly for census participation? For example, younger folks born here of Southeast Asian descent or older refugees, etc. So we definitely know that particular segments of the population will be more at risk for being undercounted. Particularly young children were the most undercounted group in the 2010 census. We also realized there are factors such as language and technological access that a lot of the elder population is at risk of being undercounted, especially since the 2020 census is largely going to be administered online. So those are factors that hopefully our fact sheets will try to address by specifically targeting those populations and having them or helping them understand why the census is so important, particularly for them and how they can participate. So we're also going to be working with our partners and any folks on the call who want to work with us in terms of how we can make sure that the way we're reaching out to folks, our message is getting to those populations that are going to be most at risk of being undercounted. Anything you want to add, Katrina?
I guess the only thing to add is also the immigrant population will also have like a specific fact sheet for that community, and that will tackle things around just reiterating that the citizenship question won't be included, and then also sharing some data around the different confidentiality protections that Census has to offer. We hope that would help ease some anxiety with participation. But yeah, like as Alyssa had mentioned, we're hoping that our fact sheets for the different communities could help provide some data and then some talking points for those that are trying to outreach to those communities.
So we have one question that came in, and it's a common question we get a lot, and I'm sure a lot of the folks who are working on census have gotten it, is from college students, and if they're not living at their quote-unquote home address on April 1st, which is Census Day, how do they fill it out? Are they allowed to fill it out? So the answer to that is you fill out the census as to where you're living on April 1st. So if that is at school, that's where you would fill it out for. And then there's a very helpful worksheet that we can actually share with folks who are interested that kind of goes through different scenarios such as that. So like if you're living with roommates, for example, how does that work with the census? Or if you are traveling a lot and you don't really have a permanent address, how does that affect how you fill out the census? So if folks are interested in that, and if you think that would be helpful in how you like communicate with your community members or teach your staff, we can share that with you. That was created, I believe, by Advancing Justice. So it's really helpful. It has things for things like homeless populations, folks who are incarcerated, so different scenarios and how that affects filling out the census. So if you're interested in that, just let us know after the call and we can share it out. We'll make one final call for questions. All right, if there are no other questions, we'll go ahead and wrap up early today. So just wanted to say thank you again for joining this July community call. Our next one will be in August on Thursday, the 29th. You can go ahead and register now if you are so inclined at bit.ly/AUG2019CC. If you have questions about census, feel free to reach out to me at alyssa@crac.org. Anything about our national policy updates that you might want more info on, feel free to reach out to Katrina@crac.org. And then any California-specific policy updates that you want to engage with, feel free to reach out directly to goia@crac.org. She'll be back in time for the August community call, so she will be able to get back to you. And with that, we'll go ahead and wrap up, and we'll share the recording out, and feel free to reach out if you need anything after this. Thanks, everyone.